recognize the Honourable Leader for the Official Opposition.
Thank you, Madam Speaker. Madam Speaker, this government is doubling down on evading accountability. After firing the independent, arm's-length Nova Scotia Health Board 5 years ago and installing a partisan interim CEO, this week we learned that the PC government isn't going to bring the board back. The CEO's contract is up. The NSH's budget has ballooned to $3.3 billion in the past 5 years, and the Conservatives have scrapped its oversight structure. This government has run our finances into the ground. They've shown they don't do the work to understand the impact of their decisions. Does the Premier understand why Nova Scotians need people who aren't on his payroll to oversee health care?
I recognize the Honourable Premier.
Thank you, Madam Speaker, and to all those people working in healthcare on the front lines or in administrative capacity. I want them to know we respect you. We thank you for your efforts. Your efforts are paying off. We've made incredible progress on the healthcare file in this province. Madam Speaker, over 93% of Nova Scotians are attached to primary care. That is an astounding, that's an astounding number, Madam Speaker, and we're moving up in the metrics in a lot of different areas. And the accountability that we really seek, Madam Speaker, there's lots of it in here in the chamber, outside in the chamber, Auditor General, there's lots of accountability, Madam Speaker, but the accountability we really seek was from Nova Scotians, and they spoke loud and clear. They were given the opportunity, Madam Speaker. Thank you.
I recognize the Honourable Leader of the Official Opposition.
This government evades accountability. After increasing spending by 72%, the now former interim CEO said that government is spending, quote, uncontrollably, unquote, and it has to stop. The Auditor General has raised concerns about procurement spending without competitive processes. Several of the transactions, $50 million to Think Research, for example, were not even publicly disclosed on the government's public tender website. $400 million for One Patient, One Record in a process rife with problems. 85% of renewal contracts to long-term care not tendered. Alternative spending more than doubled after this government was elected. We need accountability. Will this government appoint a new permanent CEO and reinstate the board?
I recognize the Honourable Premier.
Madam Speaker. There's more data on the healthcare system and more metrics that is publicly available to Nova Scotians now than there ever has been, Madam Speaker. We have made a big focus on making sure that Nova Scotians have access to care when they need it, where they need it, Madam Speaker. We're making incredible progress on that file. We will continue, I want Nova Scotians to know, we will continue to invest in healthcare. We will continue to make sure that their families have the care that they need when they need it, and I am extremely proud of the work that the people working in healthcare are doing on behalf of Nova Scotians, and I'm extremely proud that, Madam Speaker, we have the best healthcare minister in the country sitting right there.
I recognize the Honourable Leader of the Official Opposition.
Madam Speaker, this government can spend money. They've proven it with an historic deficit, but Nova Scotians aren't feeling the results despite all the numbers. Eliminating the independent governance structure of the Health Authority gives the government more control and less oversight. This government isn't interested in a women's health strategy. We're learning that government doesn't want oversight, they don't want accountability, and they don't want expert advice. This government, who doesn't know what's in their own budget, thinks that they know better than independent healthcare experts and administrators. Will they stop making decisions based on their political future and start making decisions based on Nova Scotians' best interests?
I recognize the Honourable Premier.
Madam Speaker. Every single decision we make is based on Nova Scotians and what is best for Nova Scotians, Madam Speaker. And when we look across what's happening in the healthcare system, we can see the improvements. Nova Scotians can feel the, just last night, somebody stopped me somewhere and said, my doctor's retiring, I already have a new one. Premier, that's how it's supposed to work. The person beside them, the person that was with them said, oh yeah, I should tell you, my parents moved here from BC 3 months ago. They now have a doctor, but for the last 3 months, they were blown away by the access to care they had through virtual and pharmacy. That's what success looks like, Madam Speaker. We will keep working. Thank you, Madam Speaker.